In this video, we are going to talk about tooth whitening. That is, what is tooth whitening? What are the causes of stains? In which conditions you should not get your tooth whitened? What is the entire process of tooth whitening? The instructions you should follow after it, and the frequently asked questions related to it. I'm Dr. Satish Kumar. This is SK Smile Dental. Our aim here is to help you smile. Tooth whitening is a cosmetic or aesthetic procedure in which we brighten or whiten your teeth by applying a chemical over it. When the teeth first erupt into the mouth, they are whiter and brighter in color. But over a period of time, because of the wearing out of the enamel and the micro cracks which develop on it, the shade becomes slightly more yellowish and tends to darken over a period of time. There are other causes which can also cause staining of teeth. For example, food and beverage habits. That includes excessive tea consumption. Tobacco consumption and smoking can also cause staining of your teeth. Now, these are external stains, that is, which come from the outside. But there are certain causes of internal stains. For example, if you have a trauma or injury to your tooth over a period of time, the nerve supply, which is the pulp within the tooth, might die, leading to a change of the color of the tooth internally. Other causes can be if you're taking medication as a child, where it affects the development of your teeth, as a result of which your teeth might be stained or look differently. Now, in which conditions should you not get your teeth whitened? Teeth whitening is usually safe, but there are certain conditions in which we advise you not to get it done. These include decayed teeth. If you have decay in your teeth, if you go in for whitening procedures, they might further cause sensitivity or damage to your tooth. Gum diseases, that is, if your gums are receded and the root portion of your tooth is exposed into the mouth, then you might end up having extreme sensitivity. So, getting your gum disease treated before you go in for tooth whitening is an essential part. Sensitivity of teeth. If your teeth are already sensitive prior to the procedure, then we need to assess the cause, try and solve it, only then go in for tooth whitening. Allergies. There are a few people who might be allergic to the content which is used in tooth whitening. Pregnancy or nursing. Tooth whitening is not recommended for those who are pregnant or nursing currently. Restorations and bridges. Now, if you already have tooth colored fillings and crowns out there, when you get teeth whitening done, the natural surfaces of your teeth tend to brighten, but the ones which are already artificial and cannot change in color, like ceramic or composites, they would remain as it is. So you might require changing the composite restorations or the bridges after a tooth whitening procedure. Certain medical conditions like acid reflux and bulimia are contraindications for getting tooth whitening. So if you're suffering from any of these, ask your dentist, come down to us, we'll explain you whether you should get tooth whitening done or not. Before you listen to the entire process, if you are liking this video, please do not forget to hit the like button below. The process of tooth whitening, it begins with polishing of your teeth. Yes, if there are debris and calculus collected on your teeth surfaces, they have to be cleaned first. Once that is done and the polishing is completed, then a gel is applied onto your gums. That is to protect it from the whitening agent. The next step involves application of the whitening agent onto your tooth surfaces. Then a light is used to fasten the procedure. After the entire process is done, the gel and the whitening agent is washed off. A shade is taken before we start the procedure and after the procedure is complete to see the improvement which has been achieved. The entire process takes about 30 to 40 minutes. There are certain instructions which you should follow to get the best results of the entire procedure. They include avoid food and beverages which can stain your teeth for at least 24 to 48 hours. Avoid consumption of tobacco and smoking. Continue with good oral hygiene practices. That includes brushing your teeth twice daily and flossing. Use a sensitive toothpaste if prescribed by your dentist. Also, do not forget to follow your 6 monthly checkup cycle. Now, moving on to the frequently asked questions. The first question we have asked is whether this procedure is permanent. No, it's not a permanent procedure, and you might get back to your original tooth shade eventually. Yes, you can get regular touch ups done to try and maintain it for a longer duration. The second question which we are asked is whether the amount of shade improvement we get is a fixed number. No, this depends on your particular case. Usually, we tend to achieve a shade improvement from 1 to 3. The third question is this procedure safe? Yes, this procedure is safe for the majority of the population. For those people who have to think before they get the procedure, we have already mentioned them earlier in this video. I hope you got a complete idea about the tooth whitening procedure. If you have any doubts, please feel free to write them in our comment section below. And do not forget to drop into our clinic to get your tooth whitening done. I'm Dr. Satish Kumar. This is SK Smile Dental. Our aim here is to help you smile.